So let's talk about something pretty high stakes, replacing a front tooth. I mean, it's not just about chewing, it's your smile, right? For the longest time, the fix was always slow and steady. But what if I told you the fastest way to fix it might actually be the best way? Let's dive in. You know, losing a front tooth is a total nightmare. But what if the fix could be super fast and, get this, actually make your smile look better in the long run? Well, we're going to dig into a huge scientific review that tackled this very question, and honestly, the results are pretty mind-blowing.
All right, so first up, the front tooth problem. See, the real challenge here isn't just plugging a gap. It's all about how it looks. We're talking about preserving the whole look of your smile, and that's especially true for that delicate gum line. If that recedes even a little bit, yeah, you're going to notice it.
So, the traditional way of doing things, it was all about playing it safe. A dentist would put in the implant, and then you just wait. And wait for months. They called this delayed loading, and the whole idea was to let that implant really lock into the bone before any pressure was put on it. But then, things started to change. New techniques came along that promised a tooth on day one. You could literally walk out with a new tooth the same day. And this set up a massive scientific question, a real showdown. Is it better to get that crown right away, or is the old school slow and steady approach still the best for how things look in the end? So let's meet the two main contenders in this fight. To figure this out, scientists went big. They pulled together all the best studies into one massive analysis, basically putting two different methods head-to-head to see who the real winner was.
All right, in one corner, you've got immediate loading, or IPIL for short. This is the all-in-one same-day solution. The implant and a temporary crown go in on the very same day the tooth comes out. And in the other corner, you have delayed loading, or IPDL. With this one, the implant goes in, but then you have to wait over 2 months to get the crown. So remember, the only difference we're talking about here is when you get that new tooth.
Let's walk through what that immediate loading journey actually looks like. It's pretty amazing, really. Step 1, the old tooth is extracted. Step 2, the new implant is placed. And step 3, a temporary crown gets attached. The key thing? This all happens in one visit. You walk in with a problem, you walk out with a tooth.
Now, the delayed loading journey? That's a whole different ballgame. The first two steps are identical, tooth out, implant in. But then, you hit pause. For 2 months or even longer, everything just heals up. Only after all that time do you finally get your crown. So you're looking at more appointments and more time with a gap. Okay, so that brings us to the main event, the aesthetics showdown. This is what it's all about, right? Forget everything else for a second. Which one just looks better? Which method gives you that beautiful, natural smile years down the road? And wow, the data could not have been clearer. Looking at patients 1 to 5 years later, the science showed that the immediate same-day crown group had, get this, almost 0.5 millimeter less gum recession. That's a huge finding.
I know what you're thinking. 0.5 millimeter? That sounds like nothing. But in the world of smiles, especially front teeth, that is a massive difference. We're talking the difference between a gum line that looks totally natural and one that just looks a little off. As you can see right here in the chart, the delayed method, the old way, consistently led to more of that gum tissue disappearing.
And the good news for the immediate method just kept coming. It was also way better at saving those little triangles of gum between your teeth, and it kept the bone on the front more stable. But why? Well, the reason is kind of brilliant. Think of that temporary crown you get on day one as a scaffold, or like a temple. It's put in place immediately to hold up the gums, to support them, and to shape them perfectly as they heal. It doesn't give them a chance to collapse.
Okay, so let's recap. Faster looks better. That's a pretty big deal. But I bet you're already asking the next logical question, right? What about survival? Is it actually safe? Is it risky to load an implant that fast?
I mean, it looks better, but is it safe to put a tooth on an implant that quickly? This was always the big argument for waiting, right? The fear was that the implant just wouldn't heal properly. So what did the science have to say about that?
Well, here's your answer. Just look at these numbers. The survival rates were practically identical. We're talking 97.7% for the fast method versus 98.5% for the slow one. I mean, from a statistical point of view, that's no difference at all. The bottom line? Both are incredibly safe and reliable.
So the science is crystal clear on this one. When it's done right, there is just no significant difference in how well the implant survives or how much bone you lose. That old fear that faster must mean riskier, the evidence just doesn't back it up. Not at all.
All right, so let's put it all together and get to the final verdict. We've looked at how it looks, we've looked at how safe it is, and the conclusion is actually pretty simple.
And you don't have to take my word for it. Let's just read what the researchers themselves said. They found that immediate implant placement and loading is conducive to the preservation of your natural tissues. So, in other words, putting the tooth on right away doesn't just fill a gap. It actually helps preserve the natural look of your smile.
This final scorecard really says it all, doesn't it? When it comes to aesthetics, the immediate method is the clear winner. Hands down, less recession. For survival rate, it's basically a tie. Both are excellent. But then you get to the patient's time. 1 day versus months of waiting? Come on, that's a knockout. So, here's the big takeaway, the one thing to remember from all this. For a front tooth implant, the science is showing us that faster can actually be better for your smile. It's not just about convenience, it's actually a better way to preserve that all-important look.
So, if you're ever facing this decision, what does this all mean for you? Well, it gives you the crucial question to ask your dentist. Am I a candidate for immediate loading? Now, it's not for every single case, that's true. But knowing what you know now, you can have a much more informed conversation. You're armed with the science.